My name is Sean Thomas, and I'm the author of Be More Today, a 40-day guide to a better version of you. As doctor of physical therapy, I've seen thousands of people do great things. They came to me with ailments, physical ailments, pain, issues, and they got through them, all because they decided in their mind they were going to do it. And I guarantee you, if you just trust the process and be persistent, you too can be the best version of you.
Welcome to the Be More Today show. Don't forget to like and subscribe to our show today. Now, let's hear it from our host, Dr. Sean Thomas.
What's going on, folks? What's going on? It's your boy here, Dr. Sean Thomas, back with the Be More Today show. We are back in the building, folks. We are here in the month of March, the best month of the year. March, baby, stand up. Yes, we are here. It is our month, folks, and I'm very, very grateful to be here celebrating my 45th birthday. What happened? I don't know what happened, but life is life and life is great. And we are here to Be More Today show, celebrating life and nixing and fixing in 2026. That's been our theme for this year, to nix and fix in 26. We've been doing that, trying to make things better for things we want to start doing and things we want to cut out of our lives as well. And in our 7th season of the Be More Today show, we've done a great job of putting that message out to everyone around the world with our 2 books, our Be More Today book, Project More, and Be More Today. They have been out there inspiring others to be great. And our Step Challenge, which starts on April 1st, is still open for registration. If you want to join our Step Challenge, please go on BeMoreToday.com and join our challenge. We've had as many as 100 people join the challenge for all these seasons in individual segments. But it's been great to have people out there just getting back to being physical, especially now the sun is out and the snow is gone. Now it's the time to be a little more active. So this show will continue to inspire others to do that, as we are now in our 7th season with over 79,000 downloads, now heard in 101 countries. This show has grown. And it's thanks to your love and support that we continue to grow, but also thanks to our sponsors. Our sponsors have been great this year. As always, Spy Belt, the best running belt in the business. Kim and her team in Texas has a great product, and they continue to put out great products for us to use as runners all around the world. So shout out to Spy Belt and their great team, but also shout out to our sponsor, JAG Physical Therapy, the best PT provider and injury prevention provider in the Northeast. As you already know, I work with JAG, for JAG, along with JAG, and we are an amazing company that is in the tri-state area with over 160 offices for all of your needs, whether it's physical therapy, occupational therapy, athletic training. We do all the things that we need to get you to be back to the life that you love. And I'm proud to continue to be a part of this wonderful, wonderful family, as you already know, because they've been great to me. And we will have 2 guests on the show today from our JAG family as well. Our monthly patrons, thank you so much for being a part of this show as always, and for supporting. And for those who are part of my journey for Boston, yes, the Boston Marathon for me is coming down now. It is April 20th. We are in 1 month away from this final marathon for me, number 6 for my 6 star, and number 10, my final marathon. No one believes me, my final marathon. And I am running with a charity called Strive for Stride. Strive for Stride is a charity that raises bibs for BIPOC populations and immigrant populations to run for free, to be able to go to races without having to pay for these races. But they also provide mental health services for all of the people on the team as well. And it's a great organization that we're raising money for. The goal was to raise $9,500. We are at $6,000. So we're $3,000 away from our goal. So if you do want to be a part of the movement for us to get to our goal for Strive for Stride, you can see the show link in the bio as well and be a part of that. We really, really appreciate it. Our quote for today is very simple as always. The simple act of caring is heroic, by Edward Albert. The simple act of caring is heroic. This is a very busy month, right? Not just because my birthday is in March, but also because March is a number of things, right? It's Women's History Month. And I think about caring when I think about my mom, I think about my wife, and all the women that I've had in my life who've been just caring forces in my life to make sure that I'm always taken care of, but also that they are selfless in that regard as well. And they are heroes in my mind, and maybe your mom or your aunt or Your wife is a hero to you as well. But the act of caring by itself is heroic. We care for each other in various ways, not just in terms of familial ties, but also in terms of healthcare. And as a physical therapist, that's one of my biggest things. We go out there and we care for those who are in need. They have a physical ailment they're trying to get back to, getting better. They have issues they're trying to work on. We provide care, and we are heroes, right? We're sometimes unsung heroes in our regard, but we are heroes nonetheless, because we're helping people to get back to the life that they love, and getting back to the things they want to do functionally in great ways. And March is a big month because it's Women's History Month, but it's also a month we focus on the lives of other heroes like athletic trainers. And JAG Physical Therapy has one, if not the best, athletic training program in the country, I believe. And I wanted to bring on two of our finest to talk about athletic training. So, on this show, in celebration for Women's History Month and Athletic Training Month, I have on the show the director of athletic training at JAG Physical Therapy, Stephanie, and one of our managers also for athletic training, Kristen. So, folks, I'm bringing on two of the best at this time. Ladies and gentlemen, boys and girls, pets included, please welcome to the stage two of the best from JAG Physical Therapy. Round of applause for Stephanie and Kristen. Ladies, going on Happy Women's Month and Happy Athletic Training Month.
Well, thank you so much for having us. We're so glad to be here another year, another March. I really can't thank you enough for making the time to have us on and talk about all good things athletic training. And thank you for again wishing us a National or Women's History Month as well. We're really excited to be here.
Awesome. Awesome.
Yes.
Listen, Kristen, you're good, right?
Yep. Yeah. No, thank you so much for having us on. As Stephanie said, it is National Athletic Training Month, so we are very excited. This year's theme is care you can count on. So that kind of goes with our whole theme of the podcast today and some things we'll be getting into. So very excited for that.
Listen, I appreciate both of you. And yes, as I've been going to the shows over the last couple of seasons, I've had both of you on the shows many, many times. And I think it's really great to not just bring on familiar faces and not just to highlight the great things you guys have been doing as athletic trainers, but also just to show the progression and growth, not just for JAG in general, but also for you as individuals. And it's been really my pleasure to continue to reach out and just to highlight the great work that you both have been doing for JAG and for our patients and the clients who are on the fields and the athletic trainers who are around the countries. You really are the heroes. And I say unsung to some regard because we don't always get the accolades that I think that we truly deserve. But I think when you ask all the patients and clients you've worked with, we are the unsung heroes for them. Actually, we are the sung heroes for them. They sing our praises very, 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 very loudly. So kudos to both of you for all the great work you've been doing. And I wanted today to talk about a couple things. But first, athletic training, as many may or may not know, still differs, right? When it comes to all the professions that we talk about for healthcare, we have physicians, we have PTs, we have nurses, we have strength coaches and athletic trainers and EMS, all these different things. Athletic training, athletic trainers combine all the different things that these professions do, and you guys are really the glue in very various aspects. So what makes athletic training different and special from all the ones I just mentioned?
Yeah. So athletic training, just like you said, really is a good mix of everything. We like to say that athletic training is very unique in the fact that you get to see athletes through every injury stage. So what do we mean by that? We mean by athlete gets hurt on the field, who's the first one out on the field to evaluate them? The athletic trainer. When they get back on the bench, they get to do that secondary evaluation, try to get that true diagnosis. We do that, right? We athlete gets injured. We know they need to get better. The athletic trainer is then going to start taking them through that initial rehab process, working on getting pain and swelling down, really trying to evaluate where the athlete is. And then from there, right, we know we're injured. We get past our initial phases. Now we want to kind of take more of that rehabilitation role. So I always like to say it's, more of a blend of every profession that we ever have, right? Doctors, they are evaluation and our diagnosis specialists. Athletic trainers do that directly on the field. Physical therapists, you guys are the rehab specialists. Great. We get a chance to do that in the athletic training room as well. Another thing that athletes do have to do is they have to get back on the field, right? So to get back on the field, we want to make sure that they're going to be really at their optimal strength, number one, but functionally ready to go back on the field. You know, I think sometimes people don't understand that it's, we can't just go straight from the athletic training room or the PT room directly back into a game. There has to be a progression. There has to be strength training involved. So athletic trainers actually take a very high role in that as well, because we need to kind of bridge that gap between, okay, we were just doing band walks and squats, and now you need to go and you need to hit somebody in a football game. So we need to make sure that they are safely returning to their sport at definitely at least the same level that they started at, but
Right.
hopefully, even a higher level to when they get back in.
Right, right. Yeah, it's funny because I always see athletic trainers, because I know how to spot them on the field. But I think many, I think I mentioned this before. When you look at football games and basketball games, there are 95,000 people on the sideline, right?
Mhm.
Everybody has
Mhm.
the same shirts on, and it's sometimes really hard to differentiate. Well, who's who? Who's the MD? Who's the PT? Who's the AT on the
Right.
field or on the court? But it really does become a team effort,
Right.
and everyone does have a specific role. What has been the collaboration like in terms of um, ATs collaborating with those same professionals or those same professions of various populations, right? Because we're talking about anyone who's either on the basketball court or on the soccer field, or the baseball field. So much of that really comes down to communication and what AT's roles going to be or what the PT's roles going to be. So, how does that really work in terms of even in today's day and age, the collaboration component of ATs being embedded in the thread of healthcare professions when things happen in real time?
Yeah. So there's something that we call the athlete circle of care. Essentially, there's, we'll say three main people involved in the athlete circle of care, with the athlete being in the middle. So those are usually athletic trainers, coaches, and then the physician.
Mm,
There's definitely people on the outside who are very involved, people like we mentioned, physical therapists, other specialists, chiropractors, occupational therapists, whatever it might be. But when it comes down to it, those are usually the people who the athlete is going to, we'll say, see the most, right?
right.
So when those people collaborate, it's really important to make sure communication is key. People don't always think of coaches being in a healthcare role. They are not, but when it comes down to it, they are ultimately, we'll say, very relevant when it comes to the athletes' rehabilitation and how they can safely enter into practice, right? So before we mentioned how athletes, when they're injured, they have to get integrated back into practice. Well, the athletic trainer isn't the one making those practice plans and, how many reps they're doing, how many sets they're doing, whatever it might be. We need the coaches to be very involved in that, and they need to know exactly where, the athlete's going to be and what is safe for them to return. How many routes can they actually run? What's the amount of weight that they can lift?
Mm,
If we're talking baseball, how many pitches should we actually be throwing in a day? So communication between the athletic trainer and coaches happens daily, not even once a day, probably up to 3 to 4 times a day, depending on what's going on. So communication with coaches is extremely important. Making sure that we really have a good set plan for the athlete, and also future planning, right? I think one thing that ATs do, and it's important as well, is to kind of think of the grand scope of thing is our ultimate goal. Well, we'll say one of our ultimate goals is to figure out when can an athlete get back on the field, right? That's
mm,
everyone's question. As soon
mm.
as they get hurt, how long is this going to take? When do they come back? And that's between coaches, parents, the athlete themselves. So that's always the first question. So it's our job to, number one, get them back on the field, but we need to do it safely. We need to do it confidently. And there's some things that we can do to kind of help it, whether it's taping, whether it's bracing. But ATs definitely have we'll say, a very high pressure threshold, right? 3 weeks for a regular person is just 3 weeks, but in the athlete world, that could be 6 games, and that's half your
Yeah,
season,
yeah.
right? So when you're out for that long, well, it's not even that long in the grand scope of things, right? But if we're talking, if a season only happens once a year and
Mhm.
that's half your season, we need to make sure we have really good communication with coaches. Ultimately, that's going to be the next question. When can they get back in the game? Which is very valid.
Yeah.
I think another way that we collaborate with people is going to be our team physician. Again, that's kind of like person number two when it comes to our athlete circle of care. They do all the pre-participation physicals. Of course, if we need true referrals, right? Athletic trainers are great at diagnosing, but when it comes down to it, we have our eyes in our hands. We need the X-ray, we need the MRI, all those other tools, and even just that one-on-one time is
Hmm.
really important.
Yeah.
Athletic trainers have a very high, we'll say high load, right? Most people, depending on whether you're high school or college, whatever it might be, they're pretty outnumbered. So to sit there and do a true nice 30-minute evaluation with a athlete is very rare. So it's great to be able to refer out to physicians so they can get us that true diagnosis if we do have an injury, or like I said previously, back to those pre-participation physicals, we need to know, right? So we need to know if athletes come in with different conditions that might be affecting them, even some more of those serious ones, right? We need to know if they have asthma, if they have a cardiac condition, sickle cell, whatever it might be. So we communicate with doctors very often to get answers like that. And then, of course, when they do get that diagnosis, once they go to the doctor, we need to make sure we are following doctor's orders. We have constant communication. They can actually get cleared, and all that kind of information gets passed down the pipeline to coaches and the athlete themselves.
Love it. Listen, the circle of care sounds amazing. And, I think it's funny. So I ran track in high school and college, and my coaches were so enthralled in the rehab process for every time
Right.
I got hurt, right? Knee surgeries, high school, knee surgery in college. My coaches were right there. And I forgot how integral their point of view was. I forgot
Mm-hmm.
how involved they were with the process of my rehab. I forgot how much they were a part of talking to the ATs and
Yep.
even my parents about that process. So you mentioning it now, definitely brought me back to a remembrance of how important the coaches are also a part of that, and the AT's role in terms of being the glue for communicating with coaches and family and whatever else. It's a big responsibility. Um,
Mm-hmm.
but it is so great that you guys are really a part of that. And yes, like you're saying, with the the timeline of 3 weeks not being a long time, but yes,
Mm-hmm.
3 weeks, to an athlete is like an eternity. You talk about
Mm-hmm.
games you're missing, even missing one game is like, oh, come on, that's gonna be,
Yep.
so talking about missing multiple games, that's heartbreak, and
Yeah.
it's so hard to talk to an athlete, especially even like a runner or a basketball player, that they can't go out there and do something because everything they live for right now is in that moment. So
Right.
I completely connect with everything you're saying, and
Yeah. Yeah.
that's real talk.
Yeah, and I think especially, I think, we mentioned the coaches, the physician, the athletic trainer, but when we talk about the circle of care, we almost compare it to it's like a bar stool, right? So it has three legs, and then on top. So on top is the athlete. So
Hmm.
their input and their feelings are ultimately the most important thing, right? They can have all these people making decisions for them. We can
Yeah.
all say that they're clear, say that they're all good, but if the athlete doesn't feel comfortable or feel ready and isn't confident to go back in, it doesn't really matter what any of us say. So I think that really getting the athletes' input and making sure that they feel comfortable and they feel safe to go back in is extremely important.
Yeah.
I think one way I always describe it to the athletes, and was like, hey, we can say whatever, but if you aren't going to go out there and be 100% of yourself, then I'll say there's kind of no point of going out there, right? You're a starter for a reason because you play 100%.
Right.
But if you can't go out there and play 100%, you're only 75% of yourself. That's not helping you nor the team. So we definitely want to make sure that the athletes go through that rehab process. They have super intense rehab. They know that they're cleared by the doctor. They've done plenty of practices where they've had, full contact, full scrimmage, whatever it might be. So when they do step on the field with that game, there is no hesitation because
Hmm.
we know when they start hesitating, they start changing things get funky. That's when re-injury occurs. So we definitely want to make sure that the athlete is feeling safe and feeling comfortable. So we're always constantly checking in with them as well.
Yeah. Yeah. I hear that. Listen, this has been a very trying winter season. As I've been training for Boston this year, and it was hard, right? There was just snow on the ground. It was just hard to get outside to do certain things. But even with all these different things, training is important. And I think training safely is always important. And I think it's hard sometimes to tell athletes to train safely when all they want to do is go out there and do what they usually want to do, no matter what's happening, especially if there's an injury or whatever else. But training safely is important to make sure we can be on the field again without injuries. What are some of the tips that athletic trainers may share with their athletes to train safely during this interestingly crazy winter season? I know spring is here, so we're happy for
Mhm.
spring, but the weather is still kind of up and down. So, what are some tips you guys are sharing with your athletes, your clients to train safely during this interesting weather?
Yeah, I think the first really the biggest thing is truly layering. When it comes down to it, I think when you go outside, it's freezing and you want to make sure all the proper layers. The great thing about layering is once you get out there and you get too hot, you can take them off. So usually our tips for layering is we say use a base layer, something synthetic or even polyester, or something like a cotton or a wool, something we say like moisture wicking in there.
Mm-hmm.
Usually, secondly, we say that's going to be like your bigger layers. So think of like your North Face jacket, your fleece, something like that that would go underneath. That's what we call our insulator. And then we have our outer layer, which is there really to protect against wind, rain, snow, as waterproof as we should get it. Make sure when you guys are buying clothing, you are reading the labels. There is a difference between waterproof and water resistant. You do want waterproof. You might have been a victim to that if you thought you had a waterproof jacket and then you end up soaking wet, right? So
Yeah.
make sure you're buying things that are waterproof as best as you can, because as we know, as soon as we start to get pretty wet and it's freezing out, we are not feeling great. And don't forget the accessories, right? Hats, gloves, the gaiters, right? Scarves are really worth it in sports, but the gaiters are great. Any sort of insulated boot or wool or whatever it might be are really good to keep the extremities warm if we're going to get cold or even frostbite, unfortunately. Those are usually our first things to go, including your hands and your feet. So we definitely want to make sure we are well insulated and very well protected in those areas.
Awesome.
Um, when it comes to conditions, just making sure we are careful, right? Snow and ice, we can definitely move in it, run in it, but just know ice is really slippery, right? We have that black ice, and sometimes snow can be right on top of it, and then it gets covered, and you can't even see it. So just be really careful when running outside. And the cold, it does affect your cardiovascular input output a little bit. It makes chest hurt, right? So if you start having really intense pain outside, definitely stop. But especially if you're not used to the cold weather, there's really no need to push it in a cardiovascular standpoint outside. Get used to it, get training out there, but your first day out does not need to be your first hardest day.
Mm-hmm. Yeah, those are all good tips. Those are all good tips. I
Mhm.
think one of the things that and I'm just looking at I saw one of the posts that we had in our JAG Instagram. If you don't follow our JAG Instagram, go on JAG Instagram and follow us. We appreciate it. On YouTube as well. I think it was Stephanie posted an ankle patient who had some ankle pain. They were trying to differentiate what the ankle pain was. And ankle pain could be a number of different things, right? I think most people say if the ankle hurts from a certain thing, it's usually an ankle sprain. It's like, oh, well, I sprained my ankle. Like my daughter, for instance, my daughter, 11 years old. She likes to play basketball after school. Not basketball like for a team. She plays like literally with her teacher and some classmates after school, and she likes to play in her Uggs. Why? I don't know. But she played in her Uggs a couple weeks ago and kind of sprained her ankle. And I came home and was limping around a little bit. So I took care of her and she was fine. And then, of course, she went and played again, like the same week in the same Uggs,
Mhm.
and then sprained her ankle again. And now she's in a boot. And she's been in a boot for a little while now. And we took her to the orthopedic, and she actually has, we believe, Severus disease, which
Oh,
again is like an irritation of, the bones and the growth plates, and she's growing. So it's a whole bunch of different things that are happening with her. But I say this because a lot of people think that it might be one thing because it's like the typical thing, but it could be something totally different. So, I think I want to ask both of you as athletic trainers, as people are going back out there now and the weather is getting nicer and The weekend warriors are going to start coming out now because they want to be outside. They're kind of tired of being indoors. Usually, this is a time when injuries spike up. So, what are the things that you can share with the listeners about ways that they can kind of differentiate what's happening with their bodies when things kind of feel weird, whether it's an ankle sprain or even something that's similar to that? How should they be really trying to assess what's happening with them when these minor aches and pains do occur and they're not sure how to diagnose what's going on with them?
Yeah, I think that's a great question. I think luckily it's not UGG season anymore. So hopefully no more injuries to UGGs. I think I've been there myself. So yeah, I think to start, like you said, yeah, especially with the nicer weather, you might have people going out and trying things they've never done before or they haven't done since last spring or summer. And if you, I guess, do start to feel those aches and pains, try to think about what you've done to get to that point. Did you change your shoes? Did you change your intensity when you were working out? Have you tried a new sport? We know pickleball is huge. We also see that, it's very prevalent here at JAG, physical therapy itself, with our CEO, John Gallucci's newest book on pickleball. But that book itself also helps show you, what injuries can happen, why they might happen. So I think it's just taking a look at what have you done. If it's the pain isn't unbearable, you're able to walk, you're still able to move, you're not compensating too much, try to think about what you've done that was new and maybe try to change that little by little. If you got new sneakers, try to wear them in. If you weren't warming up, maybe try to warm up. So obviously there's so many factors that can go into why you might, start feeling the way that you do. But I would say, especially after a few weeks, if things are getting progressively worse or not getting better, always see a healthcare professional, but take those notes that I kind of just mentioned in terms of tracking what has changed. So you can bring those to the physician or physical therapist that you see, so they could also try to help figure out what has went on to get you to this point, and what kind of help is needed after. So I know we're going to see that a lot right now, especially with everyone itching to get outside and maybe doing some new activities that they haven't done. But definitely track what you've done differently to get to the point that you're at.
Yeah, shout out to John and his book on pickleball. I know that's probably the newest sport. People are like, oh, I'm playing pickleball. And people are just out there. They're out there and they're out there in droves. But yes, some of the injuries we have seen in the clinic, and I'm sure you guys have seen as well, are people who were not prepared to play pickleball.
Mm-hmm.
And they're coming back now with ankle injuries, ankle sprains, Achilles tendon tear, all these different things because there was no real prep for them to go out there and play this new fun sport. But everyone's doing it because it seems like it's less intense than tennis, but a little more intense than ping pong. So they're like, let me hop. I can do this. But yeah, like you said, prepare for that thing is huge. And shout out to John as well. John and I have the same birthday. I don't know if you guys know that. We're both March
Yes, that's
23rd.
right.
Yeah. So big up to John Gallucci, our
That's
CEO
coming
of
up.
Physical Therapy. Happy birthday to you, sir. We salute you as well. We salute you as well. So listen, the theme for this year for athletic training is care you can count on. And the quote that I mentioned earlier in the show was, the simple act of caring is heroic. And I do see athletic trainers as being heroes. I mean, I think about all the times I've seen ATs rush onto the field when players have heart attacks and when players are going through certain things. You guys are really on the forefront, at the front line when things go wrong in real time. PTs were here, but you send them to us after you see what's going on, right? We kind of take on the reins after there's already been some kind of assessment. But ATs and others are really on the first line of real-time assessments to get people to be either back on the field immediately or to see what the next step is going to be. So I was curious, what does this theme really mean for athletic training when you talk about care you can count on? And how does that theme mesh with our JAG physical therapy theme for getting back to the life that you love?
Yeah, I love that. I think it meshes really well, actually. I mean, as athletic trainers ourselves, Kristen and me, and the team that we work with, I think we can all agree that care you can count on really defines what athletic trainers do every single day, regardless of the setting that they work in. I think athletic trainers are the consistent presence for athletes and the communities that they serve. So let's say at the school level, athletic trainers are there for practice. They're there for game day. They're there to do the rehab when an injury occurs, or they're there to do the prehab before an injury occurs. We're there for emergency situations. So again, that community that athletic trainers are working with, they know, hopefully by now, like we said, we've done a great job advocating for ourselves, but still want to share that with the community, is that they expect ATs to be there, immediately, regardless of how emergent something is. But I also think it's really important that athletic trainers are there before anything goes wrong as well. And that's where, you can really count on athletic trainers. I think we've already mentioned we collaborate with a ton of other professionals, not just, healthcare professionals. We really help coordinate that care to where the athlete needs to go in order for their care to be seamless. And again, to get them back out on the field as quickly but efficiently and safely as possible. So I think ATs being there from the very beginning, and seeing them through that injury and helping them get the care that they need. Again, it just shows how athletes and those patients they work with, how they can count on us. I think it's like the reliability, it's the accessibility, it's consistency over time. So that, I really, really love the slogan this year, because I think it helps showcase what, everything ATs are doing from the start. And I also just briefly mentioned, regardless of the setting, right? So the traditional quote unquote setting that you see athletic trainers in is that school setting. But you can see us across a variety of settings. We see us in physicians' offices, in the industrial setting, in public safety. So again, regardless of the patients we're working with, those patients, athletes, can count on athletic trainers to help them before anything even happens. So with that, I think, meshing with getting back the life you love, I mention all those settings because you don't have to just be an athlete to know what an athletic trainer is or to work with an athletic trainer. And whether that's, like we mentioned before, getting back out on the field, because 3 weeks is a long time, or maybe it's getting back to work because you have to get back to work to provide for your family. There are so many different individuals working with athletic trainers right now. And because of them, they're able to get back to the field, get back to their job, get back to doing their day-to-day, which again, I think encompasses getting them back to the life they love. So I do think it actually goes together really well this year, and helps really showcase where you see ATs and who they're working with and what they're doing.
Awesome. Listen, what exciting things are we doing with our AT program at JAG for 2026? I see a number of flyers out there, and everything I see is super exciting. But do you mind just sharing some of those things with the listeners today?
Of course. So, Kristen and myself, we work with a ton of athletic trainers in a lot of different capacities and a lot of different settings. The settings I just mentioned, the schools, the high schools, the colleges, the professional sports, but then also the industrial setting, the public safety setting. And, we have athletic trainers on the field that are helping people each and every day. So now that we have that foundation of being able to provide the care that we, want to give to the community, we are really trying to focus on, again, our collaboration with other healthcare professionals, but also the partners that we work with who might not have athletic trainers on the field each and every day, like those high schools and those colleges. So we are really trying to put an emphasis on emergency planning, and helping those partners of ours or those settings that don't necessarily have athletic trainers there each and every day, be as prepared as they can be for an emergency if there's no healthcare provider on site. So helping them recognize what's emergent versus non-emergent. What are the steps they can take to safely help an athlete that gets hurt, and the next steps they need to take in order to get them back to the field. Is it sending them to a doctor? Is it sending them to a PT? Is it, hey, I think we're okay with this one. They can walk this off, right? So I think we've, unfortunately, we see more and more, situations in the news that do require, like you mentioned, like a coach goes down with a heart attack and someone has to use an AED. And we've seen some really great outcomes with that. And I think that's why we now want to put an emphasis on that emergency planning, to help that, the communities that we serve feel as prepared as they can be for something that could potentially happen. It's not happening every day, but I think, like I mentioned, because we have really good foundation of being able to provide the care that the community deserves. Unfortunately, athletic trainers still only have 2 legs, 2 arms, and the same amount of time in every day that they can't be in at every single game in every single setting possible. So if we can help those youth organizations, again, those other community members that we serve that might not be able to have an AT there each and every day, feel as prepared as they can be to act in an emergency without that athletic trainer on site, that is, that means everything to us. It's not really just making sure about ATs being in every single game at every single moment. It's about making sure that everyone feels prepared even when we're not there. So that's something we're really looking forward to doing. It's a culmination of everything we've been doing over the past few years where we can really start to put our focus into. So we're looking forward to sharing that with the community this year.
Amazing. Amazing. Well, listen, I think our program is the best. And I think the collaboration between ATs, PTs, OTs for JAG is just incredible. I know most companies don't have um, that robust of a program where we have everything encompassed into one. But I do think that when things like happen like this, we can refer patients everywhere. We're talking about PT, you can go here. You need OT, you can go here. You have an athlete who needs this, we have these. And that's, I think, what makes us special and better than the rest. And I don't just say that because we work with JAG. I say it in all honesty. I think just talking to all of our patients and even some of the athletes that we work with, they're very, very grateful for how encompassing JAG is with our programs and how professional we are and how efficient we are. And I think it is kudos to the tutelage of leaders like you, Stephanie and Kristen, in this regard, but also clearly tutelage and kudos to our PTs and OTs for the programs as well that we have around the tri-state area. So very, very proud to be a part of this team and very, very proud that our program for athletic training continues to be one of the best, not just in the tri-state area, but in the country. So again, shout out and salute to you as athletic trainers, but also you as women, as we celebrate Women's History Month. And I know it's funny, we have at my clinic, we have more male PTs than female PTs right now. And I think for the last couple of years, it has been like that. And my associate, Grace, is always like, oh man, I'm the only female here. And it's true. She's the only female therapist at this time. But there's such a power, and there's such she is one of the most caring individuals that we have in our clinic. Patients see it, we see it as individuals, and it's something that really just comes out in so many different ways. So I think in the spirit of Women's History Month, I just want to say thank you for being great female leaders in this company, but also as female leaders in healthcare, which sometimes is not always seen because it can be a very male-dominated profession in some regards. But I do want to just shout you out as females and let you know that I appreciate you, we appreciate you, and wanted to celebrate you for this month as well.
Well, thank you so much. Again, that means a lot. We're so grateful to be here and be able to speak to the profession as, like you said, female ATs in this profession, but leaders of this company. So yeah, really excited to see what we're able to do.
Yeah.
Moving forward.
Yeah. Listen, if someone wants to learn more about our athletic training services or more programs that they can be a part of, or if just looking for ATs in their area, how can they reach out to us at JAG or to you guys as individuals?
Yeah, no, that's great. I mean, we're always open to speaking to schools, organizations, athletic programs in general, community partners, to help them learn about how athletic trainers can help, support safety, injury care, performance, emergency planning, like I mentioned. So if someone wants to reach us, you can go to the JAG Physical Therapy website at jagpt.com under athletic training services. They can contact Kristen and myself through our email, which is athletictraining@jagpt.com. Again, you can reach out about anything and everything. If it's something we don't do, which is rare, we'll pass you along to the right people at JAG PT that can help. But, we have a ton of different service lines that we are more than work them on. So email, website.
Awesome. Any final tips you want to share, ladies, about the quote we said today, about the simple act of caring being heroic, or any tips you want to share finally for our listeners about athletic training as we close out this special month for you?
I think one thing that would be, this can really go for anybody, but I think athletic trainers definitely take a unique step on it. In regards to caring, is kind of almost being an advocate. So athletic trainers are always an advocate for the athlete, right? For their safety, for their health, for their well-being. Sometimes, people are pressuring them to play when they shouldn't, or they're pressuring themselves when they need to play. So we need to restrict them. So I think that athletic trainers do a great job of that. So kudos to every athletic trainer out there listening who is the advocate and cares about somebody enough to restrict them, and also is able to kind of speak for people. I think that anybody, whether you're an athletic trainer, physical therapist, or really anybody, just being able to be that person who needs to be the advocate for others. So if it's somebody who can't speak for themselves, has difficulty speaking for themselves, sometimes you need that person who's able to step up and take care of others. So I think that this kind of falls under the whole theme of the general podcast of Athletic Training Month and things that we just kind of do as human beings, is to really advocate for those who can't, and for whatever circumstances that they're in.
Awesome. Awesome. Anything you want to share, Stephanie?
I think you're mute.
I couldn't have said that any better myself. I think in addition to like just the injuries that we work with and because of the athletes we work with, like we said, if we're caring, because we're also humans, and we care about those we work with. I mean, lending someone a phone charger that's been at school all day and doesn't have a phone, or giving them a snack because they ran out at lunch, right? I think, like Kristen said it, I think we do a lot more than what is on paper, or what are what's included in the definition of being an athletic trainer. So that simple act of caring outside of the scope of athletic training itself is how I think athletic trainers show that they care. And like we said, that's care that these athletes and the community can count on. It's not just the injury that happens or injury that might happen that we're helping them with or through. It's a lot of other things, because we are that consistent presence on site. So yeah, I mean, maybe not a tip, but we're all human, right? We might have a focus on one profession, but there's a lot more that we can do to help people outside of, again, the specific role that we're doing each and every day.
Absolutely. Well, ladies, thank you so much for being on the show today. I really, really appreciate it. And I wanted to say, again, congratulations on a great program on Athletic Training Month and on Women's History Month. We salute you all. And thank you for being on the show. I really appreciate it.
Thank you so much.
Yeah, thank you.
No problem. And we'll probably do this again next year, as we always do.
Absolutely. We look forward to it.
I love making sure that we continue to highlight the great programs we have at JAG. We have so many. And I will always continue to be my focus for you guys. So thank you so much.
Thank you.
Thanks, Sean.
No problem. No problem. Folks, I am blessed. I mean, they were amazing today, just talking about this great month of athletic training and talking about women leading in athletic training. I mean, it's amazing to see the growth that we've had for this program over the last couple of years. And I'm inspired to go out here and to care more for my patients, and to know that our athletes are being cared for, and even our people who are not athletes, who are just trying to go out there and give back to the life that they love, are being cared for by ATs around the world. So shout out to our athletic trainers for this month. And again, for all of our women for this month. And again, to our CEO, John Gallucci, who has the same birthday as me, or I have the same birthday as him, March 23rd, March Baby Stand Up. We salute you, sir. And for all those who want to remember the quote from today, the simple act of caring is heroic. It is heroic. So if you're a healthcare provider, athletic trainer, PT, OT, or whatever you may be in this healthcare profession, let's continue to care for others heroically. We are the heroes, not unsung, but they are the heroes who go out there and inspire others to be better and to be more in everyday lives. So continue to go out there and to care. And again, the theme for that training, care you can count on, is something that we should be able to have our patients count on every single day. Going out there and doing our best for them is heroic. Let's be the heroes we want to be, not just for each other, but for the rest of the world. And thank you so much for watching the Be More Today show. We'll see you guys next time. Peace.